Evening. This is the Town of Littleton Board of Health meeting for Wednesday, October 12th, 2022 at 7 p.m. We will start off with the public hearing for the ID decision support tool and discussions on COVID updates in the community. I'm hoping Matt Wason has some information for us.
All right, here is the latest infectious agent decision support tool. We still have Omicron BA.5 as our vast majority of cases at just under 80%. Number 2 is BA 4.6, and number 3 is the growing new variant that is, I think, was first detected in China and is now spreading. It's about 5% of the cases here in Massachusetts. It is BF7. Too soon to tell how it is different, but as with most of the variants we've seen, they're probably saying vaccinations will provide reasonable coverage. Not sure how it might be different in terms of infectivity or how serious an illness you might get with it. Littleton case counts just kind of have slid down a little bit from a little bump for about a month in September. And most of our metrics just kind of remain in the yellow categories that we've been seeing week to week, as well as down in the, the CDC community level stays at yellow medium, and then the wastewater numbers are still hovering around the kind of the 1,000 mark, but they dipped a little bit below it for the last week or so. So nothing jumping out at me from the dashboard perspective. I'll take the moment to say that Kevin Baker and I met with Lynn Snow from the Littleton Public Schools Health Office to talk a little bit about the school data and what we could get. It looks like the schools are doing well. They're not getting a lot of reports of cases. I think what was eye-opening for me is just to know that the schools are effectively not doing any testing whatsoever. So the only way they know about cases are if parents voluntarily inform the nurses about the cases. So that just, we expected that would not be a firm source of data, and in fact, it is not. And I recommended that they kind of continue to communicate the message to parents of, please do tell the schools if your child tests positive for COVID, just because it helps keep the communication lines open. And that would be the primary way that any of the nurses at any of the schools would detect an outbreak at this point, is based upon that external reporting, because they don't have any primary sources of data.
Dan, what are you seeing out there? Boots on the ground.
We're still seeing a fair amount. Looking at hospitalizations is probably for me the biggest flag here, that the data here was reported as of the 4th, showing we're 80 and 90%, and I just double checked the state site, and that is the most recent data the state has. Yeah. In practice out there, I will say that emergency departments are significantly busy. I know the last few months their volume has increased significantly. Hospital availability, inpatient beds is decreased significantly. That the current state numbers on the website, I don't think are necessarily reflective of practice, at least in our little corner of the map for the hospitals that most of our residents would frequent nearby. That it's not necessarily COVID, it's a little bit of everything, but COVID's in the mix as well. So it's hospital beds are tight every place. That we don't need to be there, don't be. Even with the numbers, on the downside, that's awesome. But COVID and everything else, do your best to stay healthy, because you're going to be waiting a very, very long time in the hospital.
Now, Matt, we did discuss the CDC community level and the guidance at each level. Now, the colors, are they still, is it yellow, orange, red for the CDC? That we talked about that a little bit.
Yes. So I think technically it is green, yellow, orange.
Yellow, orange. Okay.
If I recall correctly.
And so with orange being the high.
Correct.
The guidance that the CDC, the latest and greatest, that they've issued is that if you're in a high transmission area or your CDC community level is high, the guidance would be to mask in all public spaces indoors.
Correct. That's effectively what the CDC is saying. They're saying that if you get into that high category, there should be general masking going on in public places. And depending on your community or depending on the scenario, even in yellow, you should be thinking about it or considering it in the right circumstances. What those are, they don't spell out, but that is what we had out of I believe it was alluded to in their guidance on the K through 12 institutions, but that's their general comments on that community level.
Got it. So we'll keep an eye on that. We'll keep an eye on the wastewater. We'll see if that ticks up, and hopefully everybody by now knows to practice all the mitigations that we have, all the tools that we have, and stay as safe and healthy as possible.
Boosters are out there. Boosters are available. I didn't have any trouble getting an appointment on 24 hours notice. So please get your boosters if you are able to, based upon your dose schedule, and that helps stay safe.
And there is another Vax clinic coming up. I believe it is October 28th. Yeah, no, I'm sorry, October 26th from 5 to 7 at the Littleton High School. So we'll put some PSAs out about that, and also have test kits for distribution there as well. So it's time for 7:05 for a public hearing on 101 Goldsmith Street, featuring Evan Carloni of Innovative Septic Design. Is Evan in the audience? There he's coming. Okay. Hi, Evan.
Can you hear me?
Yes, we can. Do you have a plan you can share with us?
I do.
Awesome.
I do, yes. Let's see here. Screen share. Goldsmith. Okay. Are you able to see the plan?
Yes.
Okay, so this, let's see, let's get rid of that. So for 101 Goldsmith, this system is a geomat leach field. We had relatively high groundwater at this site. Our test holes, we had groundwater, the estimated high groundwater at 40 inches and 32 inches. 40 inches in test hole 1 and 32 in 2, which is closer to the house. The building sewer is more or less stuck where it is. That's the reason for the one local upgrade approval, which is the reduction from the 12-inch separation between the inlet and outlet inverts of both the tank and pump chamber to the high groundwater table, which Title V has it as 12 inches. And the local upgrade approvals section allows reduction of that as long as everything is hydraulically sealed. And then the other portion is request for approval of the 2-foot offset to groundwater, which is allowable by the approval letter issued by DEP, and just for replacement scenarios. So in a remedial use approval, they allow this when it's helpful. And in this case, it would only be a few inches raised with the 2-foot reduction. It'd be about a few inches raised from the upper portion of the yard, about a foot and a half of the lower portion of the yard, but there's plenty of room to taper out with that 2-foot reduction. So those are the two requests. The reduction from the 12-inch separation from the inverts of the tanks to the water table, and the 2-foot reduction allowed by the approval letter.
All right, great. Matt Wason, do you have any comments, questions?
I just curiosity. I don't know the grading of this property, but where is the existing system?
The existing system's directly behind the house.
Okay.
I don't see if you see my mouse, this box that's labeled 1. So there's a tank here and then there's a field.
Got it.
And
So just
that is-
only out of curiosity, any reason not to look at the west or southern area from the barn?
So the west or southern area. Yeah. So you really start to, when you start looking at the northwest here, it does get, it gets tight. We've got the 10-foot setback to the property line, 10-foot setback to the barn. There's really not much room in there to work.
Okay.
Let me see what I've got here. Just pulling it up quick to see what space we have from the edge of the barn. So right, the edge of the barn to that property line is 22.5 feet. So that only leaves 2.5 feet.
Yeah.
And then in the rear, let's see, we've got 32 feet. So that would leave a 12-foot.
Yeah.
12-foot operating, where we can fit it without requesting variances from there. So, and it's pretty overgrown. I should have shown it on the plan, but it's pretty overgrown back there. So you'd have quite a bit of tree work to do. Where this side yard here in the back is, it's wide open, other than a fence that runs along this area, which they want to take down anyway. So it's pretty free and clear.
Okay. And then just you said it quickly, you're the expert on this, but again, the 0-inch separation from inlet and outlet tees of the tank or of tanks.
Yep.
There are 2 tanks going in.
Yes. Yeah. A tank and then a pump chamber.
Okay.
Yep. Because we're pumping. I think the existing system's about a foot or 2 in the estimated high groundwater table, and we're getting 2 feet. We're proposed to be 2 feet above it. So since those tanks are more or less locked in place, we have that second tank, which is operating as a pump chamber to pump the effluent up to the field.
Got it. Thank you.
Yep.
Dan Kane, any questions?
I don't think I have any questions.
All right, I'll go ahead and read Jim's notes here. 101 Goldsmith Street. The sewage disposal system for this site is in the seasonal high groundwater table based on the previous Title V inspection report and therefore in failure. Soil testing was conducted and a suitable location was found for the replacement system. The groundwater table was high, 32 inches, and the perk rate was on the high side, 21 minutes an inch. Along with the soil test results, there have other constraints which make the installation of a fully compliant sewage disposal system difficult. The applicant is requesting a local upgrade approval for the offset between the groundwater table and the tank outlets. The existing building sewer will dictate the tank elevations with the high groundwater table. And with the high groundwater table, it is not possible to comply with this section of the regulations. In order to minimize the potential for surface runoff onto the abutting lot and toward the house, the applicant is requesting approval for a 2-foot groundwater offset reduction allowed by DEP in their approval of the GeoMat system. The area is served by town water. There are no wetlands nearby, and the system is pressure dosed, providing equal distribution of the effluent over the leaching area. In addition, both the septic tank and the pump chamber will be equipped with filters to help provide clear effluent before it is discharged. This should improve the longevity of the system. I don't see an issue with approving this applicant's request. So if we have a motion, that would be great.
I'll make a motion that we grant the reduction to a 2-foot reduction from groundwater for the leaching field and the 0-inch reduction or 0-inch offset from the groundwater for the inlet and outlet ports of the tank.
Second.
All right, roll call vote. Dan Kane,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
and Kevin Baker votes yes. Thanks, Evan. I think we have you again.
Yes, we do. Perfect.
All right. Yeah. So we have our 7:10 public hearing for 40 Shaker Lane with Evan Carloni of Innovative Septic Design.
So let's see. Goldsmith, screen 2. Looks like that might still be on the other one. Do you see a different plan? Do you see 40 shaker here now?
Yeah, that's a different plan. I don't see. Yeah, 40 shaker. Yeah.
40 shaker. There we go. So this is this plan is very similar. Also a geomat system, and we actually ended up just yesterday. I received comments from Jim. I thought it was only going to be the 2-foot offset, but actually I overlooked that we're looking at a similar, the same local upgrade approval, except instead of 0 inches, we're looking at 0 inches. Let's see. Here, let's see. Oh, I do have it at 0 inches. Well, anyway, so it's very, very comparable. This system here, we've got high groundwater at, let's see, we had in test hole 1 in the field, right on the edge of the field there, is at 30 inches. And then down a ways, we've got in test hole 2, we had it at 26. So a little bit higher, but we were lower in elevation. So it's not a huge surprise. We're also pretty locked in on the location vertically of these tanks, also a tank and a pump chamber. We couldn't quite make this gravity, unfortunately. I placed a note. This plumbing comes out underneath the foundation. So there's really no way for me to tell in the field if we're able to raise these tanks. So I did place a note under the schedule of elevations that if possible, while maintaining a 2% pitch, we should look at raising these tanks out of the estimated high groundwater if possible. And that's just something we'll have to try to do upon construction if we can. But if not, we are requesting the local upgrade similar to 101 Goldsmith for that reduction from 12-inch separation from the inverts down to, again, I believe it's 0. I believe that estimated high water mark is right around the inverts of the inlets and outlets of that tank. Buoyancy checks out just like Goldsmith did. And then it's the same deal here with the geomat, the 2-foot offset. We're looking at, with the 2-foot offset, we're raising the grade here about 1 foot to 1.5 feet. So again, we're taking a system that's definitely within the groundwater table. I believe we were the distribution box was 40 inches down. So I mean, even the top of the distribution box was a good foot below the high groundwater table. So we're taking a system that's well into the groundwater, picking it up above, and asking for that 2-foot offset so that we're not looking at a crazy mound off the back of this property here.
All right, I'm going to go ahead and read Jim's notes on 40 Shaker Lane. The septic system for the property has failed a Title V inspection and needs to be replaced. Soil testing was conducted and a suitable location was found for the replacement of the system. The groundwater table was high and the perk rate was 16 minutes an inch. Along with the soil testing results, there has other constraints which make the installation of a fully compliant sewage disposal system difficult. The applicant is requesting a local upgrade approval for the offset between the groundwater table and the tank outlets. The existing building sewer will dictate the tank elevations with the high groundwater table. It is not possible to comply with this section of the regulations. In order to minimize the potential for surface runoff onto the abutting lot, the applicant is requesting approval for a 2-foot groundwater offset reduction. The area is served by town water. There are no wetlands nearby, and the system is pressure dosed, providing equal distribution of the effluent over the leaching area. In addition, both the septic tank and pump chamber will be equipped with filters to help provide clear effluent before it's discharged. This should improve the longevity of the system. I don't see an issue with approving of the applicant's request. Evan, just a question. Can you see the sewer line going out in the basement, or you said it was under the foundation?
Yeah, so it enters into the slab.
Okay.
So it comes down vertically, and lots of times we can see it going out the wall, so we can get an elevation on it, and we can know whether or not we can raise that plumbing.
It just goes straight down through the slab?
Yeah.
Yeah.
Yeah, it's not uncommon to see that it can, they used to do that it's not a great way to do it, but they go straight down into the slab and then goes out.
Yeah, but there's no other fixtures after it goes through the slab, right? So in theory, it could be picked up all the way, or I mean.
Well, no, since it goes out through the slab and goes underneath it, basically the question is, we don't know how far down that pipe goes. So it goes down this right here. When you come into the driveway, that's the garage, and the line goes down underneath the garage slab. So there's really no way, I suppose
my question is, could there be an interior plumbing change? Could you run it to the back of the driveway where it says bottom of siding 107.37 and then lift those tanks up out of the groundwater?
Well, I think you'd be looking to do that. You'd be looking at jackhammering up garage to see if it could be lifted, but you wouldn't be able to go out of a wall, because if you went out of a wall, this building sewer line would be above ground.
Oh, you can't bring it out the back through a wall?
No, because it goes underneath the garage slab.
Yeah.
And then from under the garage slab, it crosses the driveway. So to come out of a wall, you'd be coming out of so here's the ground. You'd be coming, it would be above.
So what are you doing? You're looking to find that pipe on the right side of the driveway?
So, basically what the installer is going to do is they'll have to chase back. I would want them to chase back to the edge of the driveway anyway, to pick up as much as they can from the driveway over to the tanks. Mm-hmm. But once you start crossing the driveway, could you pick up more? Potentially. You could potentially pick up more by coming over here, but coming out of a wall of the house, you would be hanging out in the air.
You'd be above grade, right? Okay.
You'd be above grade. Yeah.
All right. Matt Wason, any questions?
I guess it's kind of along those lines, is because you're not sure about that pipe, for sure the tank is going to be no less than 0 inches above the groundwater, the high groundwater, because that's what you've asked for the variance of that offset, but we're not sure exactly how far the tanks can go down, or are we?
So there's basically, but between the house and the tank, what happens? So if we had a building sewer in a basement where I could go and I could measure where it is, and I know that we either can raise it or can't raise it, I've got something to go off of. But since that pipe goes directly through the floor, there's no way. Is it right under the floor? Is it a foot down? Is it 2 feet down? There's really no way for me to know in the field. So upon construction, what they can do is they can chase back at least to the driveway, because it's a bit less intrusive. They could chase back a bit more potentially into the driveway, but then they have to repave to try to, it's how much pitch do we have? How much pitch do we have from the house to the tanks? Is it at 1%? Is that 2? Is that 10?
So I know
if it's
that,
at 10, then we can.
Is there a chance, because the request is for the approval of the offset from the groundwater to the tank outlets to effectively be 0, correct?
Yeah.
That's what the request is. And I'm saying, can we even guarantee 0, or is there a chance that those tank outlets cannot be brought to 0 because they are too low? Or do you think, no matter what, we'll be able to put the tank in a place where the outlets are at the bare minimum at the groundwater?
Right. Yes.
Okay.
Correct. Yeah.
No matter what's happening with that line coming from the garage, the tank for sure will be at 0. And we would say, if we were going to approve that, 0 is great, but the higher the better.
Yeah. Oh yeah, absolutely. The higher the better. Yeah. Anytime that's possible, I always tell the installers, bring it up. Yeah.
Okay.
100%.
That was my question. Thank you.
And Kane, any questions?
That same piece of looking at, the street views of the house, it's coming out, the house is built on a hill, the garage is in the back of the house. So it's definitely coming out the low point that was my question is, could we just raise that up and gain that piece? But the way the construction is, you're kind of stuck. Is there an as-built for the existing system that may give you some clues to what the height is on the inlet on the existing tank, that might be able to do a little bit of basic geometry and get a sense of where that pipe should be?
Well, so there's nothing, all I have is a Title V. It's a pretty old system. The Title V gave me the, the depth down to the top of the current septic tank. But for the plumbing, they basically just say goes down into the foundation. So there's no way to know. Yeah.
Yeah, no, I don't have any other questions.
Okay. I'll make or is there a motion? Anyone?
I'll make a motion that we, oh, go ahead, Matt, it's all you now.
I was going to say, I'll make a motion that we approve the reduction in offset from the groundwater to the outlets to no less than 0 inches, as well as a reduction in the groundwater offset to 2 feet, or of 2 feet, sorry.
I'll second that. We have a motion and a second. Roll call vote. Dan Kane,
Dan Kane, yes.
Matt Wason,
Matt Wason, yes.
and Kevin Baker votes yes. Thanks, Evan.
Hey, thank you all for your time. Have a good night.
You too.
Good luck, Evan. Thank you.
Thanks.
So we have a 7:15 discussion on 550 Newtown Road, discussing the plans for replacing the failed sewage disposal system. This is actually regarding their attendance at our meeting a few weeks ago. It's probably a month ago, where we had said that, okay, just lock the bathrooms, don't use them, don't use any water, and bring in porta potties for the staff. Jim has these notes. I received a letter from the property owner after your last meeting outlining their proposed actions to maintain the failed sewage disposal system serving the property in support of an extension of time to replace the failing sewage disposal system. I'm concerned that locking the bathrooms may violate the plumbing code and provide adequate hand washing facilities. Providing adequate hand washing facilities is challenging when using portable toilets. I would recommend converting the existing septic tanks for the building into tight tanks, seal the tank outlets and install alarms on the tanks, have the applicant contract with the sewage pumping company and have the tanks pumped when the alarms are triggered. A permit for the tank conversion is needed. In addition, I would recommend that the board review of this approval with the applicant and receive an update on the progress of their plans every 6 months to ensure the compliance and review progress on the compliance schedule for the system replacement. I mean, I think we were trying to take the path of least resistance in our conversation with them. Certainly, we want to do the right thing for public health and the residents of Littleton. It seems like Jim's recommendation is to have the folks convert the existing septic tanks into tight tanks, and we'll likely have to do a public hearing for that. So if everyone here is in agreement with what Jim has to say, we can put it on the agenda for a public hearing at our next meeting and invite the property owners to come and discuss that with us.
If I recall from the meeting where we had them, my ask was put together a plan to, yes, bring to us for a public hearing where we could formally vote on it. And yes, we probably should have better called out that as a part of that plan, they should work with Jim to make the plan, because it shouldn't be us making the proposals of things that they should do. So right. I think this is going in the right direction. I think we just got step B a little bit before step A, perhaps. So I would encourage them to converse with Jim further and put together a plan that Jim can likely support, understanding that if he comes to us and says, I strongly, do not recommend you favor this method, then we're going to be stuck. So I would say, yes, go back, talk to Jim, put a plan together that you can bring to us.
Okay. Yeah, I'll have them on the next meeting, and we'll post it as a public hearing. And I'm sure they'll know exactly after talking with Jim what we'll be discussing, and they'll come prepared. So that sounds good. Let's see what's next. So we have 725, the CIRC, the Crisis and Emergency Risk Communication. This is, and I don't know if you guys had a chance to check out the link and this program and what is all involved, but it is a very in-depth, I guess it's almost like sending the right message at the right time is the crux of it all. And there's been a lot of lessons learned over the past 2 years in COVID and communications, coming from different, not only in Littleton, but just coming from all these different locations, and people sort of getting bombarded with maybe too much information all at once. But this is following the crisis and emergency risk communications and the guidance, and utilizing all the information that we've collected and learned as a people, I guess, as a country, as a society over the last 2 years. I think the board should take a really good look at adopting and practicing the crisis and emergency risk communication, so that we can have the greatest impact, be effective, work together with all the stakeholders involved, and put out the right message at the right time, so we can do the best job we possibly can. And so I'd like to put together an in-depth sort of workflow and plan on this. We should bring in the fire chief. We should bring in Chief Pinard, some of the other stakeholders, and really comb through it, and I'll get on the same page in regards to workflows and messaging in the future regarding anything crisis related, not just COVID. But I wanted to bring that to the board's attention, and hopefully get the ball rolling on implementing an effective communication plan, so that we can work smarter, not harder, and get the right message out. So if you guys are on board with that, I'll likely bring in some folks to the next meeting to discuss this, and we can get on the same page with everyone. Sound good?
And no, it's a great idea. We certainly talked about how to break down some of the silos. Having a consistent message from local government, local leadership is critical for any crisis, whether it's a public health, whether it's, even simply boil water orders, or those kind of, not simply, that's a big issue, but the things that aren't quite as long-term as COVID, for example, having a clear chain of communication, a consistent message across board, so that, you're not hearing from fire chief as emergency management officer for the community, and the town manager, and the chair of the select board, and the chair of the school committee, and the chair of the board of health, all trying to deliver hopefully the same message. But no matter how effective we are at maintaining a consistent message, the more voices that people are hearing, the more there's going to be some confusion. Right. A slip of the tongue or just a different style is going to send a different message, and that's always a concern across the board. So definitely from an emergency management perspective, it's critical to have a clear, consistent message, have a face of the town, whoever that is, as long as they can be effective. And that doesn't necessarily mean town manager or select board or something, basically identifying a public information officer who is the face for a crisis, who is the person that it channels through. And really the idea of an emergency operations center that is not merely for the short-term crisis, the blizzard, but simply for, okay, how do we truly manage messaging and concerns that come forward consistently? And, it's certainly, EOCs can be crisis, meme a bunker in the moment. It can also simply be, okay, we have a 15-minute Zoom at 3:00 this afternoon. Any updates from the day, any changes we need to make to our messaging? Nothing. Great, moving on. We'll see everybody tomorrow at 3:00. That can be an EOC as well. It's just a matter of making sure that that communication happens and the messaging is clear across board, and that it's, even if not all parties agree, that the message is still consistent going out.
That's the important part. Great. So yeah, we'll dive into that and we can get that ball rolling at our next meeting too. So we have 7:30 administrative matters. Brenda, you can hear us, right?
Yes, I can hear you.
All right. So at our last meeting, we passed a new regulation. That regulation needs to be typed up and stamped by Diane. And it needs to, I guess, stamped by the central registrar as well. And we can talk to Jim about what that means.
Okay.
But then finally, it needs to be published in the paper. So we'll need to do that. And along those lines, the trash hauler regulations that we prepared also needs to be stamped by Diane and the central registrar and published in the paper too. So those are sort of two things that we'd love you to take care of before our
Okay.
next meeting.
Okay.
And I know we have a lot of meeting minutes that need
Yes.
approval, and I know you're working hard on them. If you could please bring at least 6 meetings worth to the next meeting for us to approve, I feel like I'll feel a little bit better that we're trying to get back
Okay.
on track.
Sounds good.
Was there any correspondence that we had? Haven't really didn't see anything this week for new correspondence. Brenda, did you have anything?
I didn't have anything. The only thing that you asked is to put together the spreadsheet. And if we're going to talk about that, about the distribution for the supplies that were dropped off to the Board of Health.
Yeah, how is the inventory going?
Well, we had about 2 pallets. There is, I don't have the spreadsheet in front of me, I'm sorry, but there's quite a bit of, we have boxes of Band-Aids,
Mhm.
children's
Yeah, there
masks,
should be a lot. Yeah.
hand sanitizer, and, but I'll get the exact numbers and I'll send them to the board.
Great.
And we can decide how you want to distribute them.
Perfect. Are there any board member updates, comments for discussion? Matt Wason?
I'll put together a synopsis of the CDC recommendations based upon the community level that
Mhm.
includes individual community-based recommendations that incorporates the school stuff too, just so we have that all in one place.
That'd be great. And then we need to circle back with Lynn Snow. Hopefully it'll be this week, if not beginning of next. Just to circle back, I think we had a really good, productive conversation with her and we learned a lot. And I think that, open, constant communication is how we're going to all be successful together. So, Dan Kane, any comments, updates?
Just as Matt said, don't forget, if you're eligible for your booster, please go get it. Also, don't forget your flu shots. They are available. Certainly we have no idea what flu season is going to look like this year, but flu shots are quick, easy, and are very effective at preventing severe illness and hospitalization. And as we said earlier, that you do not want to be in the hospital right now if you do not need to be. The only other thing is, certainly after the last 2.5 years, today is actually National Emergency Nurses Day. So big shout out to our bedside caregivers who've certainly done the lion's share of the work for the last couple of years in the emergency department and every day. So
Yeah, here. Thank you very much. And in the absence of Gino, I will make a motion to adjourn. Roll call vote, Matt Wason. Or we need a
Matt
second. We need a second.
second,
Roll call vote, Matt Wason.
No ways and yes.
Dan Kane
Dan Kane, yes.
and Kevin Baker votes yes. Thank you, Brenda, and thank you, Dave. And we will talk to you guys very soon. Have a good night.
Thank you all.